Welcome, everyone. Thank you for joining us today. My name is Dr. Louise Ivers. I'm the director of the Harvard Global Health Institute. I'm delighted to welcome you to HGHI's Coffee Sessions. This is our virtual series that brings together voices from across the global health landscape as we seek to better advance global health equity. In recognition of the recent profound disengagement of the United States federal government from global health entities and global collaborations, such as the dismantling of the US Agency for International Development, reduction in overseas development assistance, withdrawal from the World Health Organization, as a few examples, we're going to be focusing this series now on dialogues about these current issues in global health. Today, we're going to discuss some of the US membership in key global institutions, why we were part of them in the first instance, what they do, and where we might go from here. A few notes: the session is being recorded through Zoom, and the recording will be made available on the HGHI website and YouTube page in the coming days. We do plan to have time at the end of the presentation to answer your questions. So if you do have a question, you can submit it through the Q&A feature at the bottom of your screen, and we'll do our best to get to those today. With that, allow me to introduce our distinguished speakers. I'm delighted to welcome you both. Dr. Tom Frieden is a physician trained in internal medicine, infectious diseases, public health, and epidemiology. He is the former director of the United States Centers for Disease Control and Prevention and former commissioner of the New York City Health Department. During his time as director of the CDC, Dr. Frieden led pivotal efforts in the global response to major health threats, including playing a key role in responding to the 2014 Ebola outbreak in West Africa, amongst others. Dr. Frieden currently serves as president and chief executive officer of Resolve to Save Lives, where he leads the organization's efforts to partner with countries to prevent 100 million deaths from cardiovascular disease and to make the world safer from epidemics. Welcome, Dr. Frieden.
Thank you.
Dr. Stephanie Psaki is a public health leader with expertise at the intersection of national security, global health, and equity. She previously served as a special assistant to the President of the United States and the inaugural US Coordinator for Global Health Security at the White House, a role that included overseeing the federal government's response to emerging global health threats such as Mpox, Ebola, and Marburg. While on staff at the National Security Council, Dr. Psaki also coordinated US government engagement on issues ranging from HIV/AIDS as a public health threat, investing in health workers, expanding access to sexual and reproductive health services, and protecting human rights. She previously worked for 20 years at NGOs and research institutions and holds a Ph.D. from the Hopkins Bloomberg School of Public Health and a master's degree from the Harvard School of Public Health. So it's an honor to have you both here today. I'm delighted to dive straight into the issues. So let me start off, please, with a question framed around the World Health Organization. Dr. Psaki, I'll start with you. In a prior role, amongst your other responsibilities, you were responsible for the US government's relationship with the WHO. Would you start with the historical importance of the establishment of WHO and the US's role in that, and maybe some context for everyone who's listening about the capacities of WHO, why we had remained a member of that, and what, if any, legitimate critiques may exist about the organization?
Absolutely. Thanks, Louise, and thanks to the Harvard team for pulling this together in the series of talks, which are very relevant and helpful, and I look forward to following along with the ones that happen in the future. So this is a big topic, but let me try to just spend a few minutes on kind of the origin of WHO, the strengths, some of the critiques. WHO, along with other UN institutions, was created in the wake of World War II. There was agreement by a number of countries, including the United States, coming out of World War II and having just experienced 2 world wars, that there was a need for a better structure through which countries could work together to promote peace, promote security, and promote cooperation. So if you can imagine being in that mindset coming out of World War II, just thinking, we don't want this to happen again, how can we do things better? And I think it's good to keep that in mind as we look at the conversations that are happening today. So the World Health Organization was founded at the same time as the rest of the UN agencies that were founded right after World War II, the United States was very closely involved in that as a founding member, helped to structure WHO and the rest of the UN system, and helped to, set up the governance processes. So in terms of what WHO does in the world, I think it's helpful to think about some of the systems that we have here in the United States that maybe are not in place in other countries, at least not at the same scale. So we have in the US, and I know Dr. Frieden will talk much more about the role of CDC, but we have a really robust federal, state, local health system in place so that there are experts, epidemiologists, but also clinicians and many others who can track threats to Americans, who can make sure that clinicians have the right guidance in place, who can make sure that we know when trends are changing in terms of population health and we respond accordingly. So CDC plays a huge important role there in the US, and we have a very robust federal and state health system. We also have NIH and universities that are doing research, have been until recently, research to make sure that they're looking at issues affecting Americans as well as affecting those around the world. And then they work closely with FDA, the Food and Drug Administration, to make sure that we have safe and effective medicines for Americans. So this is a really strong, really effective and robust system that we have that in many ways has been the envy of the world for a long time. And I know we'll talk a bit about some of the cuts there. Not every country has this system in place. And so the role that WHO has played historically is to try to pull together guidance and issue guidance and recommendations for countries around the world to make sure that they know when health threats are changing, but also how the changing guidance, how the guidance is evolving to respond to known health threats. So just as an example, if we think about maternal and newborn health, WHO fairly regularly develops, updates guidance to countries around the world on the best practices for maternal and newborn health. They share that guidance really transparently. It's open and available to anyone. And many ministries of health around the world then use and adopt that guidance for their own domestic practices. It's a much more efficient way to do it than to have every country around the world come up with their own guidance, figure out whether it's right, evolve with trends when you think about the many health issues that are facing us. One of the other really important roles that WHO plays is flagging for the world when there is a public health emergency, so they can declare a public health emergency of international concern, and also coordinating the response to those public health emergencies. So they've done this, I think, 7 or 8 times since 2007 when this kind of FAIC idea came about, thinking about a few different Ebola outbreaks, the West Africa Ebola outbreak that was pretty widespread and serious, the Zika outbreak in South and Central America, COVID-19, Mpox, H1N1, a few others. So when WHO declares a public health emergency of international concern, it has a few effects, but one is that they are, sending a clear warning to countries who don't have epidemiologists like we have in the US at CDC who are tracking these threats and can tell them. To say this is something to pay attention to, you need to look out for the symptoms of this, you need to make sure that you're ready to contain it. And also to just share ongoing and evolving clinical and public health guidance as a threat emerges. So again, it's much more efficient and effective to have a centralized source for this. In terms of the main critiques of WHO, and I think it's important to say that in the last 4 or 5 years, WHO has undertaken a really robust reform effort. It's something that we pushed very hard on during the Biden-Harris administration. But I think that reform effort is kind of structured roughly around the main critiques. So one, of course, is about WHO's response to emergencies. There was a lot of frustration about delayed response to the COVID pandemic, delays in declaring a public health emergency of international concern, and frustration, including from the US government, that there was not clarity about the origins of COVID even to this day because we didn't get sufficient data and evidence from China at the beginning of the outbreak. I think there's been concern also in general, there's been a lot of focus on COVID, but I think there has been frustration in general that WHO has not responded as quickly and robustly as needed in times of emergency, sometimes, not always. Another one of the critiques has been just around the budget and funding. So a sense that there's a lack of transparency, not necessarily intentionally from WHO, but because of the way their budget is structured, it's very difficult to understand clearly how the different flows of funding are going in to support different priorities. So just quickly, the way that WHO is funded is through assessed contributions, which are set for each country. They give a set percentage every year based on their economy. And then voluntary contributions, which are, as they sound voluntary, countries can decide to give them, but they're often earmarked for specific health issues. Because of most of WHO's budget is from voluntary contributions, it becomes very difficult for member states to track how much money they have for what and how they're delivering on what they've been asked to do. And then the third main critique is around governance, which, is just a common one when you have large institutions, that they can be very bureaucratic and unable to pivot quickly, and a need to improve just kind of accountability and ensure member states have a clear role in decision making. So all of those things are not particularly surprising when you have an institution with the tasks they've been given, also keeping in mind that a lot of what is assigned to WHO is assigned by member states. So they are trying to respond to what member states have asked them to do, which is often much exceeds the budget that they have and even the scope that they were given originally. So just to end in terms of why the US has remained a member, again, I think it's good to go back and think about that origin story for WHO and for the UN system coming out of World War II, realizing that there was a need for a multilateral system that facilitated collaboration between countries. That doesn't mean that collaboration between 194 member states is easy. There are often a lot of disagreements, which is why it's so important to have these institutions in place to help foster agreement. But I think that core of just, do we believe in multilateralism? Do we believe that cooperation between countries is important and valuable, and that we're willing to do the work that is sometimes hard work and frustrating work to make sure that we maintain peace and security and cooperation? I think certainly that is something that the US government has valued for a long time. In terms of kind of just more direct self-interested pieces, so the assessed contributions, the piece that's required from the US government is about $130 million annually. That is not a lot of money for the US government. It really is a drop in the bucket. The US government also usually pays another, 450 million or so in voluntary contributions. But again, that's voluntary. So we could decide at any time to shift those to different issues, or to not pay the voluntary contributions at all and remain a member of WHO. So it's a relatively small investment for a big payoff that really does help keep Americans safe. And I'll just give one very concrete example from my experience. Last fall, there was a Marburg outbreak in Tanzania. We learned about the outbreak, or winter, we learned about the outbreak from WHO before it was public. I think about a week before it was public. And then DG Tedros flew to Tanzania and met with the Minister of Health and met with the leadership to talk to them about the outbreak and encourage them to share the outbreak publicly, which they then did, which not only made Americans safer, but it made the world safer, and certainly countries in the region. That is not information we would have had if we hadn't had the relationship that we have with WHO, and if WHO had not been doing the role that it does globally. So it very tangibly protects Americans. But also the role that they play as this coordinating body of sharing guidance. I gave that maternal health example. To the extent that we believe it's valuable to have guidance shared with people around the world about how to keep their populations healthy, this is a very worthwhile investment for Americans. So let me just pause there, and I'm sure Tom has other things to add.
Yeah, thanks. That's fabulous. Dr. Frieden?
Sure, thank you. And thank you, Stephanie, for such a really clear overview of what some of the key issues are. I think of this a little bit personally, because I was the US representative on the executive board for many years under the Obama administration. I also was seconded to WHO for 5 years. So I've worked within that organization. WHO has real strengths. It has a reach that no other organization has. Um, when it also has ability to convey things that countries will listen to. In my current organization, Resolve to Save Lives, we were working to eliminate a toxin, artificial trans fat, from the world's food supply. And we joined and partnered with WHO to call for the global elimination of artificial trans fat. And we co-created a technical package for that called Replace. if we as an NGO or the US government had called for that, and the US has eliminated trans fat under both the Obama and first Trump administrations, it wouldn't have had much of an impact. But with WHO calling for that, now close to 60 countries have eliminated trans fat. The models are that that will prevent more than 9 million deaths in future years. And the fact that we can work with countries and say WHO has called for this is really quite important. In the infectious diseases, WHO is central to tracking systems like influenza. So we have a network of WHO collaborating centers that track different strains of influenza, so we know which strain to put in our vaccine each year. When it comes to things like measles and rubella, the US has funded, but through WHO, a network known as Gremlin, the Global Measles and Rubella Laboratory Network, that tracks measles and rubella spreads and does genomic fingerprinting so we can track where different strains are coming from and see the global movement of these diseases. There are also a lot of countries where, for a variety of reasons, both geopolitical and security, the US can't readily work. We can't get the information, but WHO can. It has a neutral broker experience. And if we look at things like the eradication of smallpox, that is one of humanity's greatest achievements. And that was achieved during the height of the Cold War when the United States and the then Soviet Union worked together with WHO as a platform, with health being a bridge to peace. So I think WHO has a really important role, and the US involvement has been really important and has been bipartisan, as Stephanie says, to keep us safe. To give you an example, when the current Trump administration abruptly removed all CDC staff from WHO, that included nearly half of, well, 5 out of 12 of the professional staff working in the global immunization program at WHO. And that's really a deadly blow, another big blow to the malaria program at WHO. It's a partnership and it's synergistic. It helps us, it helps WHO, it helps the world. But as Stephanie says, there are legitimate critiques of the organization. I think we get the organization we insist on. And some of the problems, I know there's been critiques, oh, there's too much influence of one country or another. From my perspective, the challenge is anytime you have to make policy that 194 countries all have to agree on, you're going to end up with a very lowest common denominator. And this is a real challenge. There also is political influence in things like the selection of regional directors, which is very problematic. You really want the Global Health Organization to be making decisions based on merit and the quality of staff. But it has essential roles in the guidance it provides, in the data it provides, and in supporting countries. To do that well, I think they need to continue to increase accountability and the availability of data. As Stephanie says, I think transparency on spending is very important, and focusing on effective country support. And when they produce guidance documents, they should make sure that they're actually practical. So I'll stop there.
Yeah, that's fantastic. Thanks, both of you, for that really comprehensive, discussion of the strengths and some critiques. You both touched on emerging infectious diseases and collaboration and the WHO's role in notification and declaring public health emergency. Recently, most of the World Health Organization member states agreed on a draft pandemic treaty, which had been a number of years in the making. And I thought it's interesting because does that mean just the world is going to keep moving ahead without the US? What did you both see in that progress, maybe despite or because or whatever, without the United States involved? What does that mean for us, or what does that mean for the global health world?
Well, I can share first, and I'm sure Tom has other thoughts. First of all, I think it is a big success to celebrate that member states agreed on a text. And also a year ago, there was a big success in agreeing on amendments to the international health regulations, which, pretty immediately are going to have an impact on keeping us all safer. I think the text that member states agreed on, interestingly, is very similar to where things were a year ago, which is kind of how these negotiations go sometimes. So I do think there's some amount of, seeing some of the rapid changes that have happened in the last few months, including in the US, but not just in the US, and realizing that we need some momentum to make progress collectively. So that is great to see. I will also say that, roughly speaking, the terms of this agreement are terms that the Biden-Harris administration had already largely agreed to on behalf of the United States. So very much think that joining this agreement would be in the interest of Americans. There are a lot of details to sort out in terms of, and that will be difficult details as they always are with these agreements. And I hope that they are successful. I think that, the idea of the world moving on without the US, it's really important to say that WHO and UN institutions and multilateral institutions can move on without the US government. They are not moving on without Americans being implicated. So what is captured in the text of this pandemic treaty, but also the decisions that are being made in the UN system, whether or not the US government is at the table, they affect Americans for better or for worse. So to me, it's very irresponsible for the US government not to be at the table defending the interests of Americans and the United States. But it's not realistic to think that we can completely withdraw. We are affected every day in many ways by the decisions that are made in these institutions.
Yeah, thanks. And you gave the example, a very practical example of Marburg, a very worrisome infectious disease and an outbreak that you were made aware of ahead of its public information that gave the government, the US government, time to prepare, contribute, respond. How do you see the risk specifically related to outbreaks and outbreaks of serious concern of infectious diseases? Maybe Tom, I'll ask you to take that one.
Well, just in terms of the pandemic treaty, there are some really good parts of it, good protections for healthcare workers, commitments to donate 10% of manufacturer product and another 10% at affordable prices, tech transfer, public funding conditionalities on epidemic management, research and development. This is a big issue. The taxpayers pay a lot of money to develop vaccines and biologicals, and then frankly, companies profiteer on that during pandemics, and that's not okay. So if government is investing taxpayer money, then taxpayers need to be shielded from some of the costs that companies recoup or charge on that. There's an irony here. The US has often played a spoiler role in negotiations at WHO and other UN agencies because they insist on a series of measures that weaken treaties, and then they refuse to sign anyway because you can't get a treaty through any U.S. Senate. So, maybe actually it was a little helpful not to have the U.S. there, but it's not good for the U.S. because when our voice is there, we can influence the discussion. But in terms of outbreak response, the larger issue is what's happening to global health. And I think that is something that is very important to get a handle on because the damage that's being done by the kind of three blows, or maybe four. One is the US pullout and defunding of WHO. So you've got a destabilized WHO, both with a big budgetary gap and pull out of core staff who are helping to run essential programs that keep the world and the US safe. So one is the WHO problem. Second is the abrupt pulling the rug out from global health with the closure of USAID. And the implications of that are massive. And they're really just beginning to be outlined in HIV, TB, malaria, maternal health. There are something like 200,000 healthcare workers in Africa who've lost their jobs as a result of this. And this isn't just about jobs. This is about people who were caring for pregnant women, treating people with tuberculosis, making sure that outbreaks are found and stopped. The USAID also had important programs for global health security. The third broad trend is other countries pulling out of global health with budgets constrained and increasing funding on security. You see a real risk. And then you have other international organizations like Gavi, and the US has now indicated its plan to renege on its commitment to the Global Vaccine Alliance that has saved literally millions and millions of lives. What that means is the likelihood of millions of preventable deaths around the world and a less safe United States. It's really important to emphasize that there are some things that are negotiations where one party wins and one party loses. That's not how global health actually works. When other countries are healthier, we are better off. It's a win-win situation. And it's much more efficient and safer to support and partner with other countries so they can find outbreaks faster and stop them sooner. Stronger there, safer here. This is not an either or. This is the world being safer and the US being safer. And what we're getting is the exact opposite, an undermining of decades of support. You can certainly say, hey, we should have had a better glide path to reducing US support and getting more support from domestic budgets around the world. But doing that overnight is not a recipe for progress, it's a recipe for disaster.
Yeah, thanks. You mentioned Gavi, so maybe we could spend a few minutes talking about Gavi, and I'll give Dr. Psaki a chance to weigh in. Gavi, the Vaccine Alliance, has been a phenomenal contributor to vaccinating, especially children around the world, and supporting countries to do that. What do you see as the expected impacts of this big cut by the US administration to our contributions to Gavi? And should we expect, or might we expect, other countries to step in? Is that a solution? That's something that has been said. Others should step up, other countries should do this. The US shouldn't be having to make these big contributions. What are your thoughts on Gavi?
Yeah, so first of all, I think the way that Tom laid out the major disruptions that are happening in the global health space is a great way to think about it. These are all connected and are going to have, much larger impacts collectively than if you pulled out any one of them on their own. So, I think it's hard to even anticipate the broader impacts we're likely to see. So on Gavi, just to take a minute on what an incredible institution Gavi is that we worked very closely with when I was in the White House, but I have no interest in Gavi other than they just were an incredible partner who we picked up the phone and called over and over again in times of emergency while they continued to do their ongoing life-saving work. And we need more institutions like this. So the model that Gavi has is Gavi, the Vaccine Alliance. So it's a public-private partnership that helps to vaccinate children around the world. So routine childhood immunization. They vaccinate more than half of the world's children against deadliest diseases, things like measles. So they estimate that their work has averted almost 19 million deaths in the last 25 years, just in terms of scale. There's very few interventions that we could say that about so decisively. That's incredible, especially if you think about how cost-effective their work is. They also maintain global stockpiles of vaccines for a number of different vaccines, but that is something that was useful to us in Ebola responses, for example, because they maintain a stockpile of Ebola vaccines. One of the great things about Gavi, and something that is, I think, one of the reasons that it's enjoyed bipartisan support for a long time in the United States is that they have a very intentional model of transitioning countries off of support. Right now, countries, they estimate, are paying about 50% of the costs of vaccinating these children. So it's not, some of the models where you have pure funding coming from donors and then you're just bringing vaccines into the country, paying to roll them out. The countries are fully sharing the costs, and there's a clear timeline for transitioning countries off of support, and they have a track record of doing that successfully. One piece about the role that Gavi plays that I think people don't realize how essential this is that because they are a centralized source of procuring vaccines, they are able to buy vaccines in bulk at a lower cost. So it's much more cost effective than suggesting that countries do this individually. There are other institutions that do this, PAHO and UNICEF, but it's a model that I think is really important when we're thinking about cost savings in this space. Partly because they do so much bulk procurement, Gavi actually invests about 4 times the amount of money that they get from the US government in the private sector. So everything about this is a good bet. It's a good investment. It saves lives. More money comes back into the private sector than is going out, and it's transitioning and sustainable over time. It is an obvious investment to anyone who's been working in this space, and pretty baffling that at least there's an indication right now that the Trump administration might be withdrawing funding from Gavi, although hopefully that's still a question mark and there will be a change of course. So in the Gavi is going into its kind of replenishment round. And during the Biden-Harris administration, we pledged at least $1.58 billion over 5 years to Gavi for their 2026 to 2030 replenishment round. It's, you know, a multi-year pledge, which because of the budget cycle in the US, there's always a little bit of uncertainty. But there are some early indications that the Trump administration is looking at withdrawing funding completely from Gavi. So if they do indeed withdraw funding from Gavi, the estimate is that it will lead to 75 million children around the world who will miss out on vaccination, and more than 1.2 million children who will die as a result. I think one important point to make here as we think about other donors stepping up is that the US government has not historically been the leading donor to Gavi. The US government, you know, even with this size of a pledge, contributes about 13% of Gavi's budget, and Europe actually has collectively contributed about 60% of Gavi's budget. So hoping to see continued leadership from Europe and other regions stepping up to fill the gap. But I do hope that the US will continue to support Gavi because it's such an incredibly good investment.
Thank you. I want to let you, Tom, comment on that if you'd like, but I also want to make sure we have time to talk about the US CDC. So maybe we could turn our attention to that, to the CDC for the moment. And would you give us a brief overview of how the CDC grew to include such an important role in global health, and the CDC's role in the global stage, when maybe it expanded to include diseases beyond infectious diseases and outbreak response. And we'll get then a little bit later to how all of these things coordinate.
Sure. And I guess you have to go back to the basics. What is the mission of CDC? The mission of CDC is to protect Americans from threats, whether those threats are man-made or natural, whether they are from the US or anywhere in the world, whether they're infectious or otherwise. And often when there's a new threat to our health, we don't know what the cause is. It might be a toxin, it might be a new pathogen, it might be an old pathogen. So I'll just share a slide here that gives a history of the CDC, because there is a long history of the CDC having activities in a variety of areas that is interesting to understand, because it's about the broad range of health risks that affect Americans and how to protect Americans from those risks. And I think the global work is important in that it has an ethical and a solidarity reason, but there's also a self-interested reason for Americans. CDC started in 1942 as the Office of Malaria Control and War Areas. And if you can see the slide here, below the dotted line are the communicable disease programs. Oops, sorry. And you can see these expanding to an epidemiology unit, veterinary public health, enteric or GI diseases, the Epidemic Intelligence Service, the disease detectives, the field station on communicable disease in Puerto Rico that later became the dengue or arboviral branch, the STD or venereal diseases, hospital infections, nosocomial infections, tuberculosis control, then the MMWR, the core publication of CDC on all emerging health threats, vaccination, and then you see again in the communicable space, global smallpox eradication, malaria, the quarantine program, polio, the global AIDS program, and more recently, more programs in immunization and other areas, but also non-communicable diseases from a very early time, from the 1950s. Actually, the way we measure cholesterol was standardized by the CDC, looking at what causes birth defects and how to prevent them. Nutrition, smoking and health, a very effective program that led national and state progress and is the only program in the country that supports comprehensive action in states. This program was ended overnight by the current Trump administration. The National Institute for Occupational Safety and Health that helps businesses and workers figure out how to be more productive and safer, also ended by the current Trump administration. Global Reproductive Health Survey Unit, so we can support mothers around the world and reduce the risk of disability. Toxic Substances and Disease Registry, environmental health more broadly, with an amazing laboratory that tracks the existence and spread of various toxins or contaminants in our environment. Field epidemiology training program that trains people around the world, injury prevention and violence epidemiology, reducing things like senior falls and traumatic brain injury, ended by the current Trump administration. The National Center for Health Statistics, how we know what's really happening, a core part of CDC work. This is slated to move to the so-called Administration for a Healthy America under the control of the political appointees of the HHS. This is very concerning to me because we want our data to be insulated from any other influences. The Center for Chronic Disease and Health Promotion. To say that we should only handle communicable diseases is like telling CDC, you have to protect Americans, but with one hand tied behind your back. And then the Center for Injury Prevention and Control, which has been central to the initial progress we're seeing, reducing the horrible epidemic of opiate overdose. And in my time at CDC, we issued guidance on a better, more sensible use of these very dangerous medications that were being very irresponsibly promoted by some of the pharmaceutical industries. So what you see in this is an understanding that CDC works to protect Americans, and it has done that by protecting Americans from infectious disease threats and cancer, heart disease, brain injuries, and other non-infectious threats from the US or anywhere in the world, from man-made problems with improvement of laboratory safety, and from naturally occurring with identifying problems where they emerge and addressing them. And all of that is very much at risk at present.
Yeah, thanks. Could either or both of you comment on how you see the consequences of a major reorganization or downsizing of CDC then? I mean, you kind of infer some of that by giving us that nice explanation of what the function and the role of the CDC is, but could you share a little bit about how you imagine this actually playing out, what the consequences could be?
Yeah, I think what we'll see is some immediate impacts, but much deeper, broader, and more harmful long-term impact. For example, right now, the city of Milwaukee, Wisconsin is dealing with lead poisoning exposures and increased lead levels in their schools. They asked CDC for assistance. This is what's called an EPI aid. It's a very formal way that the state sends a note to CDC and says, send us some disease detectives and disease control specialists to help us stop this. And as far as I know, for the first time in CDC's 75-year history, CDC said, we can't. They were all just laid off. We don't have that expertise. Now that's very obvious. And Secretary Kennedy said, oh, we're going to restart that program, but no one's seen any action to actually restart it. But some of the other things are much more long-term. For example, CDC has been tracking a very concerning trend among women. Preeclampsia, high blood pressure can lead to seizures and death. It's been increasing for reasons that are unclear. CDC has supported systematic analysis of what's causing that, supported states. All of that is gone. So we don't know how to protect American mothers because of these very abrupt and very misguided moves. That means sicker Americans, less protected Americans, higher healthcare costs, more deaths, more disability. And that's not just from things that are cut in this country, but also things that are cut globally, like the measles rubella network that tracks and helps keep us safe. It's the first line of defense, not just against measles and rubella, but things like Ebola, bird flu, RSV, dengue, and other deadly threats. No other country has stepped in to fill the gap. No private donor is going to fill this gap. And this is a real problem. The other thing that's quite concerning about CDC is the cuts to CDC is the virtual complete elimination of the communication function of CDC. This isn't about press releases. This is about when CDC scientists do studies that have implications for Americans, there are professional communications experts who assess which audiences need to hear this information, how will they hear it most effectively, who will be the best messenger, what questions do we need to answer. They've run a helpline that was shut where Americans called to get answers from CDC, and putting out information so that we can be clear about what we know, what we don't know, what we're doing to try to find out more, and what is sensible for people to do to protect themselves so they can decide what actions to take. The final thing to say about the cuts to CDC is that about 3/4 of all CDC dollars go to state and local health departments. And that's to support programs on lead poisoning prevention, asthma, heart disease and stroke prevention, traumatic brain injury prevention, air pollution, senior falls, STD, TB, lots of different programs that keep people safe and healthy. And those programs are being abruptly canceled, have been abruptly canceled.
Yeah, and I mean, I think we often say that when public health is best doing its job, you don't really know it exists. And so I think it can be hard sometimes for people to really, who are not in the business, to really understand all of those really comprehensive things that you've just described. Dr. Psaki, in your role at the White House, you coordinated global health work across the US government, and we mentioned your role in interacting with the WHO and others. Some of the critiques that have led to the downsizing, cancellation, etc., were related to the notion of cost, expense, duplication of effort, etc. Could you speak from your experience a little on how these different efforts were coordinated or normally coordinated at the federal level?
Sure. I again fully agree with what Tom just shared, in that, I think also this paying attention to both the immediate impacts of these cuts, but also the longer term impacts, which are going to play out, for a generation or more across the board. So just wanted to plus one to that. So in the previous administration, something that we built on that had been started for a decade earlier across administrations was developing a playbook for responding to biological threats. We finalized this playbook and shared it before the end of the administration. So it is, available across departments and agencies, but it basically laid out step by step what the roles are, both within the US government and with outside partners in times of emergency, in all different types of scenarios. So roughly speaking, when there's an outbreak that happens outside of the US, CDC is responsible for leading the response across the US government to coordinate the response and make sure that we have an incident response structure that is operational. And they work very closely with, at that point, USAID and the State Department on engaging at the country level in the response. Part of that role was working closely with these outside institutions. So the roles were very clearly delineated within the US government for both emergency response, but also for ongoing efforts. That playbook, however, will need to be updated given the many changes that have been made in the US government. I hope that it has been, or that's in progress, because otherwise there's no plan in place for responding to an emergency right now, given that the structure has changed pretty dramatically. In terms of coordinating with outside partners, also very clear. So as I mentioned, WHO has this role of, issuing guidance, saying clearly that there is a public health emergency of international concern to the world. That doesn't determine the US government's actions or constrain the US government in any way. CDC, working with the White House and others, will take action when they need to, however they need to, regardless of what the guidance is from WHO. But it is also very helpful to have clear guidance from WHO to the world about what's happening. And often that partnership is very close between WHO and the US government through CDC in times of emergency in characterizing a threat, communicating clearly about the threat to the world. Because again, as Tom said, what's happening in the rest of the world affects Americans. We're not having a pandemic that only happens in the rest of the world and doesn't come to the US. So Gavi, as I mentioned, plays a critical role in procuring and distributing vaccines. And this, this bulk procurement idea is really important, but also their ability to navigate the many, many steps that it takes and are different from one country to another of getting vaccines into a country and distributing those vaccines into a country. There's no other institution that can play the role that Gavi plays as an alliance. CEPI, who's been the Coalition for Epidemic Preparedness Innovations, another critical partner and newer partner, does investment in the development of vaccines to counter emerging threats and known threats. And that is critical work that is complementary to the work that is happening within the US government, but is also looking at the threats facing the world. So it frees up some of that space and resources for us to focus on the threats facing Americans and for CEPI and others to focus on the threats facing the rest of the world. So the coordination with each of these organizations, just to give one example, when the Marburg outbreak happened in Rwanda, CEPI had an ongoing partnership with Rwanda on research and development and building some mRNA manufacturing capacity. Because of that ongoing partnership, CEPI worked with the government of Rwanda to get a randomized controlled trial protocol in place in less than a week after the outbreak was announced so that we could start testing an experimental Marburg vaccine in Rwanda to see whether it was effective. That if we're waiting for the data from that trial, but if we're able to collect data on new countermeasures, it means that next time there's a Marburg outbreak, which currently has about 80% case fatality rate, we don't have to worry as much about Americans being affected or dying from Marburg because we have a countermeasure that works. And that's because CEPI was on the ground with the government of Rwanda when that threat emerged.
Thanks. We have about 10 minutes left, and I'd love to turn our attention to what capacities and future organization of those capacities might be a way forward. I think we spend time thinking about what has changed, but also if we want to make a path forward, being pragmatic, there may be ways to reorganize or things to think about, whether that's at WHO, and you touched on that a little, or at CDC. I'd love both of you to weigh in on how you see the critical capacities and maybe how to organize them for global health and health security. Tom, would you like to start?
Yeah. So I think we need to start with country capacities that global can help and can provide a framework, but the essential route to progress is strengthening country capacity. The Marburg example in Rwanda is a really good one. This is a very well managed outbreak. It's really tough to stop Marburg and Ebola outbreaks. A single slip and you get another many, many months more of spread. You need close to perfection in treatment, infection control, contact investigation, and follow-up. And they did it. So it really gives you a sense of the benefits, both health and economic and social and political, of having good public health systems in place. We really need to see continued strengthening, support for national health capacities. And that means the ability to track health trends in real time, good data systems. That also means the ability to respond quickly to outbreaks. One thing that we at Resolve to Save Lives have promoted is the 717 approach, where every single outbreak will be found within 7 days, reported to public health within 1 day, and all essential control measures in place within 7 days. It's a way of getting to a find a problem, fix a problem approach where every single outbreak, whether it's measles or cholera or yellow fever or foodborne illness or a toxin, is found fast and stopped soon. And with that, countries can be safer themselves. They're safer for their neighborhood, countries in their area, and they're safer for the world. So I think we need to be doubling down on strengthening and supporting country capacity with countries truly at the center. And that hasn't always been the approach of all organizations. But that, I think, is the essential principle that needs to be moved forward. And there are some things that countries themselves can do to raise revenue. For example, health taxes on tobacco, alcohol, sugary drinks, and junk food can raise tens of billions of dollars, and that can be dedicated to expanding primary health care or public health services. That means standing up to very powerful commercial interests, but it also means supporting the other commercial interests, which have a vested interest, an economic interest in having healthier workers with lower healthcare costs and more productivity, and less illness, disability, and death in working age people.
Thanks. Stephanie, would you like to comment?
Well, I agree again with all of that, and we'll just expand a bit on the financing piece, I think, because a lot is changing right now, and I think it's been very abrupt and chaotic in the last few months in a way that will be unnecessarily disruptive, and, just to be crystal clear, has led to people dying who would not have died otherwise when American taxpayer money was already appropriated by Congress. And in some cases, medicines that were paid for with taxpayer money have been sitting unused because there is no capacity to move them. So I think it's important to be crystal clear about where we are now and why we're here. That said, the conversation about needing to find more sustainable sources of financing for a lot of these health needs is one that has been ongoing for a while, and I think clearly needs to accelerate given where we are now, and probably should have accelerated before. So I think there have been a lot of conversations coming out of the COVID pandemic about investing in pandemic preparedness, financing. I think, we pushed very hard to launch the pandemic fund, and the vision of the pandemic fund is not to just continue getting funding from the same set of donors, but to actually catalyze investments from countries and from other donors in pandemic preparedness, knowing what a huge economic impact outbreaks and pandemics have. As well as making sure that we have financing available to respond in an emergency. But we're now in this broader conversation about, as Tom is saying, that there's other sources of financing, how fundamentally you're financing the core capacities of the health system, which is necessary for every health issue that anyone is facing on a day-to-day basis, which frankly are more likely to kill people around the world right now than a pandemic is currently. Chronic disease, and other infectious diseases that we've known about for a long time and have the capacity to respond to. And I agree that the core part of the conversation and the window that we have right now is understanding the role that national governments and regional institutions are going to play in filling some of those gaps. I'm actually, as soon as this meeting is done, going to join a meeting with John Kaseya, the head of Africa CDC, to have this conversation about financing and hear the message that is coming from Africa CDC and the Africa region, because that is where it has to start. And then we think about what kind of gaps we can help fill.
Yeah, thanks. That's really helpful. And one question I want to ask, and maybe I'm naive and I've been called that before, is we talk a lot about, US taxpayers and why it's good for US taxpayers to be involved in this and supporting this work. Do we still have the moral case and the responsibility case that we can make, that the United States and Americans should be part of a global solidarity to improve the health systems and the lives of our fellow humans? Or, is that a case that you think holds muster these days?
I would take it from two different perspectives. The first is to say, frankly, that it's in our self-interest. Uh, defunding Gavi means that there will be more spread of measles and the US will be at greater risk of measles. That means that there will be a slower response to Ebola and other emerging diseases, and the US will be at greater risk. So if you just stick with our just barest self-interest, we should be funding these things. But as a physician and as a human being, I would say that one of the things that the US has done that has been great has been our engagement with global health. And this has been bipartisan. In fact, I would say the most effective global health president we've had in my lifetime was George W. Bush. He started the PEPFAR program. He started the President's Malaria Initiative. He improved global pandemic preparedness. He started the Millennium Challenge Corporation. These are four seminal investments that have saved literally tens of millions of lives, made the world safer, and had given the US tremendous goodwill around the world that is being squandered right now.
I'll just add that there actually has been quite a bit of polling that's been done in the last few months in the United States, just, asking whether this is something that Americans support. And what's interesting is that a lot of those polls show that there's actually more support now for foreign aid than there was a few months ago, partly because people, understand it now because it's been in the headlines and they've been asked the questions more directly. And also because many Americans think that we spend a much higher proportion of the US budget on foreign aid than we actually do. And when you ask them what percent of the US budget we should spend on foreign aid, they largely suggest a much higher percent than we've really ever spent and probably will. So I do think it's important to remember that, and just taking a step back, again, like we are all human beings, we are interacting with other human beings here. I think it is part of American culture, both through the government, but also through private giving, to want to help people who are less fortunate, and also to want to work in partnership and collaboration with people in their communities, in their states, in their country, and around the world. I believe that that still is part of this culture. And I think the more people learn about some of the impacts of the cuts that have been made, the more invested they become in the US playing that role in the world. Now, it's going to take a long time and a lot of work to rebuild the damage that we have done around the world and to regain trust from people who previously were working in close partnership with the United States. I think that will be a generational challenge, if not longer, if we have the opportunity to do it. So that challenge is not lost on me, but I do believe that the American people want to be in partnership with the rest of the world.
Yeah, thanks. We just have 1 minute left. So any closing comments, thoughts? I've really appreciated your wisdom and insights today, but I'd love to give you the last word. Maybe Tom, 30 seconds, and then Stephanie.
I would just say it's good for America in so many ways to be engaged with the world. Not only does it make us safer, not only does it save us money, not only does it save millions of lives, not only does it give us goodwill, but it actually strengthens our ability to deal with stuff in the US. The work that US professionals, doctors, nurses, pharmacists, dentists do around the world strengthens our ability to design and implement programs that make Americans healthier. And right now, the US is a laggard. We're lagging behind other similar income countries in healthy life expectancy. And we can learn. It's not just a question of our helping. It's a question of a mutual assistance approach where we learn approaches that can be very relevant to addressing challenges, whether in rural areas or in central cities or with populations that are alienated from the government. There's a lot that we can benefit from by engaging in global health.
I think that's a great note to end it on.
Thank you both so much. This has been fantastic. Thanks to our attendees. We really appreciate you being here. And please join us in our next session. We'll continue these conversations on other topics that we've touched on today. Thank you so much.
Thank you all very much.